I'm happy to introduce myself. I am Rémi Rabasa-Loret. I am a physician, clinical researcher in Montreal at Institut de Recherche Clinique de Montréal. I am an endocrinologist, professor of medicine, and I have the chance to direct a large multidisciplinary team aiming to reduce hypoglycemia, low blood sugar, in people living with type 1 diabetes.
I am Elsa Eyman, professor in a multidisciplinary lab of Lille University, dealing with sports and health. And I work on exercise physiology applied to type 1 diabetes and with a special focus on vascular adaptations.
The main objective of the chair is to investigate in people living with type 1 diabetes, representing approximately 10% of the case of diabetes, the impact of lifelong insulin therapy, which is given either with injections or with insulin pump. The main complication of insulin is low blood sugar, also called hypoglycemia. It can lead to malaise, but it could also damage some vessels. Physical activity is important for health, but also it increases tremendously the risk of low blood sugar. For people living with type 1 diabetes, low blood sugar and less frequently high blood sugar during physical activity depend on multiple factors. For example, the type, the duration, or the intensity of a physical activity. Reproducing with exogenous insulin, what the body is used to do naturally, is extremely complex for patients.
We are working on how to improve the health benefits of physical activity in type 1 diabetes. As for example, a large part of vascular benefits is related to the production of nitric oxide in response to blood flow increase. However, our hypothesis is that this phenomenon could be blocked when sugar in the blood is too high or too low, a frequent situation for persons living with type 1 diabetes during exercise. Thus, we are trying to help these persons to avoid exercise-induced variations in blood glucose in order to maximize the beneficial impact of physical activity on their vessels.
The collaboration between Université de Lille and Université de Montréal is extremely important because in Montreal we test strategies to minimize glucose fluctuations and also assess the impact of new technologies like artificial pancreas, which is extremely complementary to what Lille is doing. In addition, we also bring our expertise with patient partners, which give us an immense advantage of knowing what is really important for the patients.
So in Lille, we are focusing on the mechanistic aspects. As for example, we artificially induce hyperglycemia during exercise, and we explore the consequences on the capacities of small and large vessels to dilate. We also measure blood markers of vessel health. So 3 students are now in joint PhD between Lille and Montreal, and the chair is giving them the opportunity to have an exceptional training.